Thank you. So as I said, I'm Judy Gooding, and I'm the project director for the initiative, Disseminating Results, Missed Sickle Cell Disease Clinic Appointments, and the Health Belief Model. This project and today's webinar is funded through a Patient-Centered Outcomes Research Institute, that's PCORI, Eugene Washington PCORI Engagement Award. This webinar is one in a series of webinars and other dissemination efforts from this initiative, which seeks to help support patients and families in attending sickle cell disease appointments. We're so glad that you were able to join us today, and I see that our group of participants is growing and continuing to grow. Now, before we jump in, I'm going to quickly introduce you to NICHQ, as some of you may not be as familiar with who we are and what we do. For over 20 years, we've focused solely on driving dramatic changes in the complex issues facing children's health. We've led more than 80 initiatives in over 20 health topics with a focus on executing and scaling systems change to improve children's health and increase equity. Next slide, please. We have a concerted effort around sickle cell disease improvement and has spent nearly a decade working on national programs, including the Sickle Cell Disease Treatment Demonstration Regional Collaborative Program, to help all of those living with sickle cell disease live healthy and fulfilling lives. At the heart of what motivates us at NICHQ is the belief that children and families deserve better systems and supports so that every child achieves their optimal health. Next slide, please. Thank you. We have two wonderful speakers with us today who I'm very excited to introduce. Dr. Suzette NICHQ is Chief of the Division of Academic General Pediatrics at Children's Hospital at Montefiore. She is also Professor of Pediatrics at Albert Einstein College of Medicine. Dr. NICHQ serves as Medical Director for the National Coordinating Center for the Sickle Cell Disease Treatment Demonstration Regional Collaborative Program here at NICHQ and funded by the Health Resources and Services Administration. She has also served on advisory panels and committees across the Northeast and the nation, focusing on sickle cell disease and improving healthcare quality for children and adolescents. And we're also joined by Ms. Talana Hughes, the Executive Director of Sickle Cell Disease Association of Illinois, where she provides overall leadership and organizational direction for the Illinois Association. She also serves on the Oversight Steering Committee for the HRSA-funded project, where Dr. NICHQ is Medical Director, that I mentioned just a moment ago. Ms. Hughes has a 17-year-old daughter with sickle cell disease, who is the immediate past youth ambassador for the Sickle Cell Disease Association of America. And she has two other children, a 21-year-old daughter and a 14-year-old son who have sickle cell trait. She is a fierce advocate for improved healthcare and patient services for sickle cell disease patients, ensuring that they receive the healthcare and supportive services they need and deserve. Thank you both, Ms. Hughes and Dr. NICHQ, for joining us today. The next slide, please. Thank you. We're here today to begin to address a critical concern for patients and families with sickle cell disease. According to a recent national study, a majority of patients, both children and adults, have had to miss clinic appointments. This means that there is a system problem at play because we know that patients and families are trying to do the best they can to get themselves and their children required care. To better understand what's behind the high rate of missed appointments, NICHQ conducted a series of interviews with patients, caregivers, and providers, where we learned about common barriers and opportunities for improvement. Today, we're excited to share those findings with you and facilitate a discussion on change strategies. Ultimately, our goal is to find ways for providers and patients to work together to make it easier for patients and families to attend their important appointments. Over the next hour, we'll address the following objectives. We'll share key takeaways from a national study on appointment attendance among patients with sickle cell disease. We'll share findings from the key stakeholder interviews, including common reasons behind missed appointments and suggestions for increasing appointment attendance. We'll facilitate an interactive discussion on systems, hospital, and individual level opportunities to increase appointment attendance. And throughout the webinar, we'll be inviting your input and expertise. In fact, before we go any further, I want to make a quick note on best practices for this call. As I mentioned earlier, although some of you may not have been on the phone, your mics are muted, and that's so everyone can hear from the presenters. And I'd also like to ask you to leave your videos off because that will help our signal strength. So we would appreciate that. Because your mic will be off, we still want to hear from everyone today. So we invite you to chat questions and comments into the chat box throughout the webinar. To access the chat box, click on the chat box image on the toolbar at the bottom of your screen. Please make sure to chat to everyone. We will try to reference these, your comments during the call and the discussion period. When chatting in responses, please share your name, where you're from, and whether you identify as a patient, provider, or caregiver of a patient. So with that, I'm now going to turn it over to Dr. Suzette Oyeku.
Thank you so much, Judy. Thank you so much, and good afternoon, everyone. So next slide. I anticipate that many of us that are on the line know a bit about sickle cell disease, but I want to make sure and just level set to make sure everyone's on the same page in the event that we have some new participants who are not as familiar. Sickle cell disease is an inherited red blood cell disorder that inhibits blood flow, which deprives tissues of oxygen and can cause excruciating pain, stroke, and end organ damage in some cases. In the cartoon on the right-hand side, you see the red blood cell. It's typically donut shape. It's very flexible and very pliable. And on the bottom image, bottom right-hand image, you see what looks like a sickled cell, which shows the shape of a sickle, and they tend to be hard and rigid, and so therefore have difficulty traversing the vasculature. Sickle cell disease is the most common genetic blood condition in the U.S. It affects approximately 100,000 Americans and millions more globally. It can occur in any racial ethnic group, but is more common in those of African American, Latinx, and Middle Eastern descent. We know that it's important for timely coordinated care to ensure optimal health outcomes. Next slide. I'm currently based in New York, and as many of you, I think we've been all impacted by COVID-19. And I think it's just important for us to kind of acknowledge the elephant in the room. We were initially supposed to hold this webinar in March, and then COVID-19 hit. And as of today, there have been 5 million cases of this virus in the US. COVID-19 is an illness caused by a virus that's spread from person to person, and it can also remain on some surfaces. The symptoms can range from no symptoms at all to very mild symptoms to severe illness causing respiratory compromise. Individuals with sickle cell disease may be at higher risk of getting this virus, and we know that public health approaches such as wearing a mask, sheltering in place, social distancing can decrease one's risk of getting COVID-19. For many people, COVID-19 has disrupted our daily routines and has impacted health-seeking behaviors. Many people have not returned for their healthcare maintenance visits or specialty appointments for a host of reasons during this pandemic. As we've discussed, some of the strategies that we're going to discuss today may help people keep their appointments, and we want to make sure that we just keep in mind the impact of COVID-19 as we're discussing some of these strategies. Next slide. So as Judy mentioned earlier, in 2018, the Mid-South Clinical Data Research Network published a multi-year national study entitled Modifying Factors of the Health Belief Model Associated with Missed Clinic Appointments Among Individuals with Sickle Cell Disease. And I'd like to acknowledge any of the authors who may be on the phone today. Thank you for this work. Their study showed that the majority of adults, 87%, and caregivers of children, 65%, reported missing a clinic appointment. We know this may impact whether patients are offered disease-modifying therapies that may ultimately impact one's health outcomes. Next slide. In the study, they found that patients, they affirmed what patients and families frequently are feeling, that there's significant barriers to sometimes keeping appointments. And some of the main reasons are listed on this slide. The dark blue bars denote the reasons that adults primarily miss appointments, and the teal colored bars denote reasons that caregivers of children potentially may miss appointments. And the common ones are forgetting appointments, sometimes that the appointment time itself doesn't work, not having a way to get to the appointment, or that the work is interfering with the appointment, that someone's job is interfering with the appointment. All of these barriers can make it difficult for a patient or family to attend appointments, and addressing some of these barriers can ultimately help improve health outcomes. In this webinar, we actually want to move from research to action and really dive into what we, patients, providers, caregivers, community-based organizations can do to help make it easier for patients to attend their appointments. Next slide. To further put this into context, we're going to play a brief video of interviews of patients, families, and providers, some of whom are actually on the call today. In this video, they'll share why it's difficult to make appointments and describe how missing them impacts health and well-being. These stories illustrate an urgent need for change.
Patients and families miss appointments for a variety of reasons. It can be anywhere from it wasn't in their calendar and it just got by them, or it can be something like other children who maybe are sick in the home. Maybe it's transportation.
You're living somewhere where there's no public transportation and you don't have your own transportation. I think that could be a huge barrier for families. So you may eventually get a ride and you're late. So unfortunately, the way physician offices operate, they sometimes don't understand the barriers that families may have. And if you're 15 or 30 minutes late, then you have to reschedule.
Maybe that child or young adult has another appointment that's conflicting, or maybe they have school or work or a test at school that they really don't want to miss, or they've already missed so many days at work that they are concerned about missing more. And when you have to choose between the consequences of a missed visit, do you miss the clinic visit, or do you miss work, or do you miss school? Sometimes that's a hard decision to make.
A lot of times patients experience just a lot of psychosocial issues that prevents them from coming to their appointments. And that could be financial, that could be employment, babysitting issues, childcare issues.
Because they may just not want to. It could be from burnout, having to go to the hospital too much. So then you really only want to go when it's serious, or if you're having a health complication and not necessarily want to go for well visits. One of the major barriers is a lot of patients and families lose hope along the way when going to hospitals or to doctor's appointments and presenting yourself in pain or whatever other complication that you're experiencing with sickle cell disease. To know that, you're kind of being treated for the moment, but it's not going to stop it from reoccurring. Those are some of the major barriers when it comes to missed appointments.
Well, there's a lot of education that's provided in appointments and regularly scheduled appointments, especially for infants and children with sickle cell. We're teaching the family about the disease pathophysiology, as well as how to manage pain episodes at home, and then also talking to them about disease-modifying therapies. And so missing out on that education may make the families less able to manage the disease at home. And additionally, since hydroxyurea is usually started at a relatively low dose, and then we slowly go up on the dose as the child's labs allow and as they're tolerating it, the hydroxyurea medication may not be escalated to the maximum tolerated dose in a short amount of time. So the child may experience more complications of sickle cell, like pain events or acute chest or things like that, if the dose isn't escalated.
Patients when they miss their regularly scheduled appointments, then they're just depending on when they get ill to get their care. So they're not seeing their specialist or their primary care providers when they're healthy, which is when we need to talk about all their health behaviors and when we can do care, really the well-rounded care that they need to prevent them from having problems.
Sometimes with missing appointments, that means you're not compliant with your medications, and the medications are needed to ensure that you're as healthy as you can be as an individual.
Sometimes it's also the impact is surveillance for their chronic disease. So there's oftentimes monitoring that is done either by lab tests or imaging. And so by sometimes missing the appointment, we may not be able to pick up certain things early enough. Sometimes we may not be assessing if someone has any complications to a medication or any interactions of any medication. You know, the goal is ultimately prevention of any complications. But if there are gaps, long gaps between when somebody sees their provider, we may be missing some of these things, and that can ultimately impact their overall health.
As that video so clearly shows, we need to make it easier for families to attend sickle cell disease appointments. This is a priority, and it's why NICHQ conducted a series of interviews with key stakeholders, patients with sickle cell disease, parents and caregivers of children with SCD, and healthcare providers from across the country. We learned about common barriers and opportunities for improvement that we will share now, beginning with an overview of the reasons shared for missed appointments. Please note that after we review these reasons, we're going to be inviting you to share additional reasons as well. So feel free to chat them in throughout this presentation or when we open up for discussion.
Thank you, Ms. Gooding. So I'd like to, before we discuss each barrier, I'd like for us to first take a moment to review the role of social determinants of health, which many of you may be familiar with. And this is an important framework to better understand the reasons for missed appointments. Social determinants of health are conditions in the environment in which people are born, live, learn, work, play, and worship that impact health outcomes. They're commonly considered within the 5 categories that are in the different circles in the above matrix. And over the next couple of minutes, we're going to discuss each reason as we look into economic stability, specifically transportation, the patient-provider relationship, including the role of implicit bias and perceived discrimination, health literacy, as well as scheduling conflicts. All of these reflect the impact of social determinants that they may have on an individual's health. I'm now going to turn it over to Mrs. Talana Hughes to begin to talk through some of these barriers.
Thank you so much, Suzette. Again, I'm Talana Hughes, and now I want to discuss the different barriers that were shared during the interviews. However, I want to start by acknowledging that COVID-19 has negatively impacted the ability of those living with sickle cell disease to get and to maintain regular or emergency care for symptoms and treatment of the disease. The SCDAA, or Sickle Cell Disease Association of America, recommends that individuals with sickle cell disease stay home and do not attend routine clinic appointments. The SCDAA also has worked with the provider community to recommend solutions to these barriers. Many routine appointments are taking place by telephone or online video calls or telehealth, and patients and families are working with providers to weigh the option to manage pain crisis at home or go to the hospital. This is our current situation with COVID-19, and it is unknown whether telemedicine for routine care and triaging acute care will remain. So now I want to go over some of the responses. Transportation definitely rose to the top as a barrier. It emerged very common both from the research study and the interviews that were conducted. The research study found that 23% of caregivers of children missed appointments because they did not have transportation. In NICHQ's key informant interviews with caregivers, patients, and both pediatric and adult providers, Transportation was highlighted as the biggest obstacle to attending appointments. Barriers mentioned included not having a car, no reliable transportation, having to travel long distances, and then the cost of transportation. Next slide. Scheduling was another major challenge that was cited. Caregivers noted that there may be times when a previously scheduled appointment conflicts with a last-minute change in their schedule or a priority for their children or family. Examples include conflicting or existing priorities for the family or child. Example, school, last-minute changes in childcare, last-minute change in work shift, for an adult or a caregiver. Providers also noted that patients may miss an appointment because they are in the hospital with an acute pain episode or other complications related to sickle cell disease. The number of appointments that a person with sickle cell disease attended also complicated scheduling. An adult patient shared that as she gets older, the need for appointments with multiple specialties has become a challenge to try and schedule around her work schedule. She can find herself with several appointments in a given month with various providers, including hematologists, nephrologists, neurologists, and endocrinologists. Given the impact of sickle cell disease on the individual's organs, and adult care is less coordinated than pediatric care. For parents or caregivers of children with sickle cell disease, or for an adult patient with sickle cell disease, appointments could also compete with unexpected work demands. There could be little flexibility in scheduling. A rare disease specialty appointment and work demands could require immediate attention over a check-in, check-up appointment. Childcare was noted by several caregivers and pediatric providers as a challenge for families with more than one child. Depending upon resources, finding care for other children so that the parent or caregiver could take a child with sickle cell disease to a specialist appointment was a challenge. In addition, one adult patient with sickle cell disease noted that she needed to find childcare coverage for her children depending upon the timing of her appointment. If her childcare fell through, she would have had no choice except to miss her appointment. Next slide. The patient-provider relationship can also be a huge barrier to a variety of reasons. Both patients and providers they both agree that the strength of the relationship based on mutual respect and trust affects routine appointment attendance. And thus the importance of the patient-provider relationship should not be underestimated. Relationship struggles and missed appointments increase when a caregiver or patient does not feel as though their experience has been respected. Patients and caregivers have reported that they feel that providers have and sometimes wield power in the relationship that can result in humiliation or embarrassment. Feelings of both embarrassment or guilt for missing appointments can keep patients and caregivers from communicating with providers about conflicts and challenges for making or attending the future appointments. Provider recognition and understanding of the reasons for missed appointments was noted as important for treating the patient with respect, alleviating embarrassment or guilt, and building a trusting relationship. Several providers and patients interviewed noted that health systems may put policies in place that offer punitive consequences to missed appointments, including losing access to specialty care after a certain number of no-shows or canceled appointments. While providers and clinic staff may recognize challenges with appointment attendance among patients, this system's policy blames the patient without compassion or respect for lived experience. One physician discussed how his team benefited from a recent training recognizing their own implicit bias as well as that of the healthcare system and the impact on patients, relationships, and care outcomes. This is important. The patient and caregiver trust can be greatly exacerbated by providers' implicit bias.
Thank you so much, Mrs. Hughes. Next slide. Given the importance of addressing bias, I want to just pause and just provide some context about the role of implicit bias in healthcare. Many of you may know that this refers to the attitudes or stereotypes that may affect our understanding, actions, and decisions in an unconscious manner. These biases can encompass racial biases, socioeconomic status, nationality, language, sex, gender, as well as sexual orientation. And we know that studies have shown that implicit bias can affect the care provided to both adult patients as well as pediatric patients that they receive from healthcare professionals. Next slide. The final barrier that was shared was one related to health literacy. And health literacy is defined as on the right-hand side of the slide as the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. In the project's key informant interviews, both patients and providers noted that the levels of health literacy played a role in navigating the health system and sometimes could result in lapses in healthcare insurance. They're also, for example, not understanding fully could impact one not understanding the instructions for attending a diagnostic test, such that the test could not take place and then subsequently needs to be rescheduled, and also not understanding the importance of disease monitoring as well as treatment monitoring. Next slide.
Thank you. Thank you, Suzette and Tilana. Appreciate that briefing. Now we're going to spend a couple of minutes discussing some additional barriers that you have faced, those of you who are participating in this call. And I have seen one come in already, or two actually, from the same person. So please chat in additional barriers or comment on the ones that you've heard us talking about so far, that we heard from the parents who participated in the videos, and parents and providers and caregivers. One of our participants has said that even for families regarding transportation, even if families have Medicaid transportation, the family can't take other children in the vehicle, and that's a big barrier, because then they encounter, as you heard from one of the folks in the video, they encounter childcare problems for the other children. And also for families who are, for patients who are going for an outpatient infusion, the limitations on how to arrive or how to get transportation to that appointment only limits transportation even further for those parents. Any comments on that from in the group chat? Other thoughts on transportation or other reasons for missed appointments? So please continue to chat in your thoughts, your comments, and the barriers that you've either experienced yourself or you've seen as a provider, as we go on to talking about opportunities. So we're going to move now into opportunities for improvement. Our goal here is that by the end of the session, you will be able to log off with at least one idea of something that you can do in the next week or so to promote change around missed appointments for sickle cell disease.
I think for me, the best thing is just setting reminders on the calendar and putting alerts with that, not just putting it on the calendar, but then sending alerts as far as reminding me that the appointment is coming up.
Patients can keep providers informed and social workers informed about their psychosocial barriers that they may have, so that it can be addressed beforehand or at the time, as opposed to when it's later and it's too late to address those issues and the appointment is already missed.
Having a care coordinator, whether that be through the insurance company or whether that be through your physician, just letting them know, hey, I need someone to help me coordinate my care, help me coordinate medications, help me coordinate transportation.
Communication is key. You need to find out what's going on, whether it's transportation, whether it's homelessness. Some providers also have social workers that's on their team that may be able to further investigate what might be happening.
Sometimes appointments are made without the family's input, and the appointment times are not convenient for them. So it's important to make sure that when the appointments are being scheduled, that the family is able to actually make that time that it's scheduled. Because if it's not convenient for the family, they're going to miss it.
And then trying to group as many other appointments. So children need TCD screenings, they may need neurology consulting. So try to group as many appointments as possible on the same day. So to minimize the amount of trips that the family has to make to the healthcare facilities, I think also is important.
It's very important for there to be an established relationship between the patient and their medical providers, whether it's your primary care doctor your specialty provider, because I think that a lot of times the medical professionals are doing a lot of work and research that a lot of times families don't know is happening. So I think the better develop that relationship is, then you can have conversations and find out, just get more information. And then be a little more prepared and ask a lot of questions, and when you can develop a level of trust.
As a specialist, sometimes what we're doing is reaching out to the primary care provider, because they often know the whole family a little bit better than we do. So we're saying, is there something that you know about this family that we don't that might be helpful? Or if they keep those appointments, can we enlist the help of the primary care provider, to talk about why it's important they come to see us, and how we can partner to have some of their visits be locally and not need to come as far as often.
All right. So accountability for attending appointments was important across all adult, patient, and caregivers that were interviewed. Those interviewed mentioned several strategies they used to manage their appointments. As you can see listed, the bulleted strategies: immediately creating appointments and reminders on their cell phones, on the calendars, scheduling travel time into their appointments, and maybe signing up for text message reminders with the clinic office. Using their hospital patients portal application also was helpful for some individuals to be able to manage their appointments. Both adults with sickle cell disease and caregivers of children with sickle cell disease noted that having connections to a support system helps make a difference in appointment attendance. For adult patients, family and friends are integral in helping individuals with transportation to appointments, including specialist visits or routine transfusions. And having family support to mitigate the challenges can help caregivers keep appointments for their children.
So now we'll shift to talk about some provider level strategies to help mitigate against missed appointments. Next slide. The research study actually emphasized the importance of providing reminder cues, as Mrs. Hughes had mentioned, to patients to improve their appointment attendance. The study noted that about 75% of respondents thought reminders would be helpful to them. And many people had highlighted having multiple reminders were more effective than just a single notification, and that voice notifications were more effective than text notifications. But we know that that varies by patient and family. We know that there are some challenges in terms of actually completing these reminders, particularly if there's change of contact information, change in cell phone numbers, or change of service providers. We also know that with the advent of patient portals such as MyChart, this provides an opportunity for families to keep communication consistent. And on the right-hand side, you see a quote from an adult patient. "With technology now, before I leave my doctor's appointment, I try to schedule at that time. I put it in my phone. That way I don't schedule any work activities around that." Next slide. I think caregivers and patients interviewed agreed that providers have a key role in ensuring appointment attendance. And I think some of the tenets is that, one, we need to continue to be respectful for patient experiences and the challenges that they face. The other is also, as providers, we need to continue to be authentic. So showing a genuine interest in how patients manage their care, both in the healthcare setting, but also their life outside of the healthcare setting. And then building trust. It's important for us to continue to engage in a genuine relationship. These three elements together provide the foundation for a strong patient and provider relationship. Next slide. Many practices have employed the use of allied healthcare workers such as social workers, case managers, and community health workers, and they are an extension of the care team. They provide additional supports such as helping to communicate appointment reminders, also facilitating communication between patients and providers, helping to support the patients with completion of necessary paperwork, and then also helping troubleshoot issues to help people foster to remember in terms of their appointments. Next slide. I think another key strategy is partnering with sickle cell disease community-based organizations, or CBOs. There's unanimous agreement about the potential of these partnerships. We know that while this is a good idea, approaches to partnering depends on the area's resources, the sizes, characteristics, the needs of the specific population being served, also the specific location of where the CBO is relative to the practices, and then the funding resources that the CBO has access to, and their staff as well as their time. We know that there are many institutions have excellent partnerships between CBOs and specialty provider practices and centers of excellence. And one social worker remarked, "We love our CBOs. They're very, very important to us because they actually have access to the patients outside of the clinic. We will directly contact our CBO and we'll say, hey, we're not seeing this patient very frequently. Can you reach out to them or go to the home to see if you can get them back engaged in the sickle cell setting?" Next slide. Another strategy is the use of integrated practice appointments. And this is considered one-stop shopping, where you actually have, where you can actually have co-located practices. And this helps to improve access to care and increases the number of care touch points in a single visit. So you can see multiple providers in one visit. And so this can decrease the number of visits somebody has and therefore minimizing some of the transportation barriers that we discussed earlier. In this new normal right now with COVID, we do need to think about the impact of social distancing requirements, and this may limit the feasibility of in-person one-stop shopping practices, but we know that several institutions are also piloting group video visits to be able to ensure an integrated model of care. Potential barriers, as you can imagine, is sometimes the days for these days are longer and can be tiring for some individuals. And it also requires a fair amount of coordination, both at the part of the patients and families, but also on the healthcare practice. And in these particular visits, if you miss one appointment, you're missing several appointments when you have these integrated practice appointments. Next slide. A last strategy is thinking about the role of satellite offices or appointments. So specifically for those that live in rural settings or areas where there's a significant distance between the care facilities, these satellite offices might be an appropriate strategy. It allows expanded access to specialist care and to also routine specialty care visits. And many of these satellite offices can be staffed by advanced practice providers such as nurse practitioners or physician assistants, and they're working in close collaboration with the hematologist. And this is a quote from a pediatric provider in terms of the outreach clinics that they set up in Northwestern Indiana. Next slide.
So as we get into strategies, we wanted to add to this slide presentation some strategies for conducting virtual appointments, because as I said at the beginning, and Talana and Suzette have reiterated a couple of times, we recognize that some of the opportunities for improvement, some of the possible strategies for increasing appointment attendance are not really workable right now because of COVID-19, because of the pandemic. And so we wanted to share some of the things that NICHQ is doing, and I'd love to hear, we'd love to hear chats and comments from you all on the phone, on the call, about opportunities you found and ideas that you have found to also reach out to families about appointments and for appointments, including virtual appointments or virtual visits or telemedicine, as well as other ideas during the pandemic and even beyond the pandemic. So we do have, you can link here, you see to an article on NICHQ, NICHQ.org, and get flyers and information about working with people specifically with sickle cell disease and beyond. So let's talk for a few moments about what you think. Let's comment more in the chat box. And as you're putting in comments about ideas, I would like to recognize that a number of issues, folks had put in issues during the last part of this presentation, including doctor-patient communications being so important. And that has come up as both certainly an issue and then also improving those communications as a solution, as a strategy for missed appointments. burnout in dealing with providers, and this is a comment that was offered by a patient or a caregiver, but dealing with provider offices that are very, very busy, a feeling of disorganized or disorganization, and I think this really speaks back to the concept of real communication and real understanding between the patient and the provider. A fear of COVID-19 itself is really adding to transportation problems, and that public transportation not being available, certainly not being ideal for patients at this point. And the cost of care and the coordination of care also came up as barriers. And the last one I wanted to note is that one of you chatted in about the language barriers, language being a barrier in the patient-provider relationship. And so if, as you're chatting in now, if you can think about solutions to those problems that you have, that some of you have recently raised, that would be great. We have a comment from Jessica Frank, who's a newborn screening coordinator in Northeast Ohio at American Sickle Cell Anemia Association. And she comments on patients really missing lately, who are missing appointments lately, who are very concerned about COVID-19. And other situations like transportation and childcare all are exacerbated by the pandemic. And good luck to Amanda Krupa in terms of who's written an NIH grant for translating materials into Spanish. Funding is hard for translation, but it's so needed. Let's see, what others are we seeing? Marigold Simon says, or Simon says, some providers allow their own beliefs to affect how they provide care for the patients with sickle cell. A provider who told a patient that he did not believe in pain medication, not even for those who have sickle cell disease. So that is really powerful and an incredibly big concern. And let's look at whether or not anyone has solutions or opportunities to add to this. All right. Let's see. We've allowed patients to get labs done locally and offered them telehealth visits if they want to stay away from the hospital. That's a great idea, both for COVID-19 and patients who are fairly far away, who have to travel a distance to their appointments, their regular clinic appointments during any time. Okay, so let's thank you all for those ideas, also for expressing the issues that you've expressed. They're very important, and really appreciate your adding to the list of problems and issues for missed appointments that we can really all together look for opportunities to resolve. Let's go to the next slide. And I want to remind everyone that this webinar has been recorded and will be available, both the webinar itself and for those of you who are on the phone who want the slide deck as a separate deck, we also have that available, and you can contact us after the webinar is over. As we close, we'd really like to hear from you all about something that you're going to do differently or do in addition based on this based on your learnings in this webinar, chat in one thing you will do in the next week to help increase attendance by patients with sickle cell disease, people living with sickle cell disease, and their caregivers. What's one thing that you will be doing? Nice, share this with the sickle cell team. Everyone, your answers to this question is going to help inform the whole project here. And we'll be able to add these ideas, your ideas in, and we'll also what you've learned. Keep them coming. Encourage telehealth. Challenge punitive policies on in-person visits and continue grant writing to encourage telehealth. Have conversations with peer caregivers and discuss barriers and issues and concerns. Nice. Chandra says, write a letter to the oversight group of the provider to find out how to better navigate their system. Offer telehealth for the original appointment time instead of canceling and trying to reschedule. Implicit bias training. This is great. We've used over-the-phone language interpreters or language interpreters in telehealth. All right, let's go to the next slide if we can. I want to say thank you very much to our presenters, to Dr. Suzette Oyeku and Ms. Talana Hughes, and I really appreciate your perspectives as parent, caregiver, and provider. And this has really been, and I very much appreciate all the participation by everyone on the phone and your patience as we got started at the beginning. So thank you very much for joining us. And before you leave, take a moment to complete this post-webinar survey or test to give us some feedback about the webinar itself and some information about what you've learned and what you're going to do in the next, based on this information. And thank you very much.